even when now you've created a additional mobility in your flap, you bring things together and you see that you've got the potential for tension-free closure. If you only suture at your incision line, you're still going to have some potential tension at that incision line, and ideally you want, as we like to call, say, tension-free closure. And the only way you're going to do that is by using a horizontal mattress suture. So any tension that's going to be in your flap is going to be in the horizontal mattress suture. And you want that to be as far away from your incision line as possible, so that again it affects the blood supply as little as possible. So in a incision of this length, you probably place 3 horizontal mattress sutures. You place one here, and one here. So the important part of placing that is deciding where you're going to make that first perforation through the tissue. And again, you want that to be at a minimum about 10 millimeters away from your incision line. So that's where, our suture pliers, especially for that initial pass, are really helpful. So we're going to go ahead and we're going to plan out exactly where we want that needle to go through, and then once we do that, we're able to pass it through the suture plier. The suture plier supports the tissue. We're able to release our Castroviejo, grab the needle on the other side, and pass it through the tissue. Now, when we grab the needle, there's a tendency to want to grab the needle and pull straight ahead. If you do that, when you're using your suture plier, you're going to bind the suture plier. But if you weren't using your suture plier and you pulled it straight, you would tear the tissue, because the needle wants to move based on the curve of the needle. So you grab the needle and you go with the curve of the needle to pass through the tissue. So again, you can see as we pass the suture through, we're supporting the tissue. So again, where we grab the needle with your Castroviejo is never at the end of the needle, because as we've talked about before, that's the weakest part of the needle. So grab it 3 to 4 millimeters from the end, and then we're going to pass through the lingual. We're going to raise the lingual flap. If there were a membrane there, we'd use this to separate from the membrane. We're going to get our 10 millimeters. Now, as we pass through the lingual tissue, we can take that spoon and support the tissue on the outside of the tissue so that it doesn't perforate and potentially tear the tissue. All right, so the horizontal mattress, again, is a rectangular type suture. So we go in the buccal and then from in to out on the lingual, which is the same as you would do if you're doing a typical interrupted. Now the difference is we're gonna go back in the lingual. So back from the lingual side, again we're going to be 7 to 10 millimeters from where we made that first perforation. We're going to be approximately right there. We put the spoon inside the tissue. Now the curved part of the spoon goes towards the flap so that the spoon will engage the needle and help guide it up. So again, one click grabs your needle. You can support the tissue. So now, again, we're going to use that spoon to help lift that tissue, get some support for the tissue on the other side. And then we're going from inside the buccal flap to outside. All right, so then to gauge that we've got good primary closure, we're going to grab both sides and pull that to the lingual and see that, yes, our flaps are coming together really nicely. Sure. Okay, so again, this is one of my favorite sutures. This is PTFE suture, and it has a little bit of flexibility to it. So I'll generally use a 3-loop on the first pass to lock it down. So get that to lay, and then as it lays, you pull it to the lingual to kind of tighten and bring those flaps together. And that 3-loop will lock it. Then you can do 1 and 1, which will then tie it. Something that's real handy so that your assistant is not just guessing where to cut it or end up cutting it too short. So is grab your tail at the length of which you want your assistant to cut it. Then bring the 2 sides together, and all your assistant has to do then is butt the scissors up against the cachevejo like that, and you get the right amount of suture left, so your knot is not going to come apart. So now we've got our first horizontal mattress in place. So like I said before, we'd do another one here and another one here, so we'd have 3 horizontal mattresses. So any tension would be far away from your incision line, and then on your incision line you go ahead and close it either with a continuous, or you can do it with single interrupted, or you could do it with kind of a 2-pass X-type suture using multiple of those. But again, the end goal is that your suture line should look watertight. So you want that to really come together, and you don't want to see any gaps. You want that to, again, look like if there's any bleeding that's kind of seeping through that suture line, it's not watertight. So you want to be sure that again, you don't want to over tighten those sutures, but you want them to bring the flaps together. Okay, so here we are. We've got our 3 horizontal mattress sutures in place, and as what the goal should be is that any tension in your closure is going to be in your horizontal mattresses, and that your initial incision line should lay passively together. So here you can see as I open up that incision line, that's laying passively together. So now we'll go and we'll place either a continuous suture along here, we'll place interrupted, or we'll place a 2-pass kind of X suture such that all of this is closed passively.